And this is interesting. When we first reported that the federal government would be providing resources so they could put this field hospital in the garage, we thought it would be a 50-bed field hospital they were setting up there with that federal disaster team. It turns out it is about 50 beds, but they're going to use half the space down there in the garage, frankly, for something that we have been waiting to see for months. I have been expecting this turn in our response for months, and we're now seeing it for the first time. They're going to use roughly half the space at this new facility, this disaster management field hospital they're setting up at the parking garage. They're going to use about half that space to set up a treatment bay for people who have COVID to come in before they are so sick they need to be hospitalized so they can get treatment to keep them from getting worse. It's going to be an infusion center for monoclonal antibody treatment. And that treatment really does work. If you test positive for COVID and you get an infusion early, before you need to be hospitalized, it can reduce your chance of having to be hospitalized by 80%. We do not have a cure, but these monoclonal antibody treatments are incredibly effective if only people will use them. Well, now they are taking steps to make that a key part of the process. Watch this. I think this is an important new thing about what's going on with COVID right now in our country. This is new.
Out front here, we will operationalize a facility that will treat initially 60 a day and maybe up to 100 patients a day that need monoclonal antibody therapy. We'll have a public-facing website where patients will be able to walk through some logic to see if they qualify and self-schedule themselves, be able to drive right up, walk in, get the therapy. We do require a little bit of monitoring after the therapy, and then they'll be able to leave. We hope that by offering an outpatient treatment venue, we will decrease the number of patients that we have to see in here. By virtue of that, we'll decrease the number of patients we have to transfer from here to the ICU. So there's a logical thought process of the medical components of this that we hope will help us have a Band-Aid to get through the next several weeks. As Dr. Dobbs mentioned, we're not at the peak of this yet, so we will need to think more creative about the medical paradigm of how we can prevent the hospital from being overwhelmed to the point where we just can't take care of patients anymore.
Preventing the hospital from being overwhelmed to the point where we can't take care of patients anymore. What they're talking about there, that creative medical strategy in terms of handling this disaster in Mississippi. This monoclonal antibody treatment stuff is something that we've talked about a lot on this show. You might remember we basically tried to raise awareness about the fact that people can get monoclonal antibody therapy in this country as treatment for COVID. It is free. The government will pay for it. It is very effective. We basically tried to raise awareness about this on the show as a treatment because not enough people have been taking advantage of it. It really can save your life. Well, what we are seeing here in Mississippi right now in that parking garage is the manifestation of what is a new concerted effort by the federal government, by the Biden administration, to try to dramatically increase the administration of this drug, these antibodies, to people who test positive for COVID. Not just to save those people's lives, to keep them from getting gravely ill, but also to save the hospitals from the huge number of sick people who are now swamping, and in Mississippi's case, collapsing the hospital system. Massive increase in the availability and the administration of monoclonal antibody infusions for people who test positive who are only mildly sick, to keep them from proceeding to the point where they need to get in the hospital. We're seeing that now in Mississippi. It makes so much logistical sense, and to see the federal government prioritize that, it'll be very interesting to see if that makes a dent.